Good afternoon, everybody. Thank you for being here this afternoon. When the governor introduced the FY18 budget, he said we didn't like the way it looked, and that in order to do what we're presently doing this year and to provide a small boost to education, we needed $440 million additional dollars. For that to happen, we would need either a bump in the Revenue Estimating Conference forecast or revenue from some of the many tax options that are on the table. REC is going to meet later this month, but at this point, no session measures have advanced very far in the process. Yesterday, the House Appropriations Committee took the first step, or should I say misstep, in the budget process. The bill awaiting action on the House floor is a non-starter for a variety of reasons that we want to outline for you today. First and most obvious, it leaves $237 million of revenue recognized by REC on the table. The governor has stated his support for not using every available dollar in the budget process, but only after we stabilize the budget with meaningful tax reforms, preferably as recommended by the task force. Secondly, the bill cuts an unspecified $155 million from LDH, plus an additional unspecified $81 million from LDH, the latter specifically to fully fund TOPS. This is a minimum of $750 million that will be cut out of the LDH budget when you factor in the federal match. The governor has repeatedly stated his hope and his intent to fully fund TOPS with the first dollar of additional revenue. He's also stated his unwillingness to reach full funding for TOPS at the expense of health care for Louisiana's most vulnerable citizens. The committee yesterday, as it has done in the past, refuses to take any responsibility for making specific cuts. Instead, the amendments virtually authorize and direct, or literally authorize and direct, the Commissioner of Administration to make the cuts, while at the same time limiting the options that are available to make the cuts. For example, the public-private partner hospitals remain cut at 6% as originally proposed in the governor's budget. The committee specifies that they can be cut no further. The committee also directs that all cuts to hospitals must be made on a pro rata basis. Now, all these hospitals have unique contractual arrangements with the state and different funding mechanisms that may not lend themselves to the pro rata cuts based upon the dollars available and the services that each provides. The committee amendments specify that no reduction can be made to graduate medical education. Such funding is driven by the arrangements with each private partner. So the committee specifies that cuts must be made on a pro rata basis, but the graduate education cannot be touched. The administration has no intent of cutting graduate medical education, but the language itself creates an inherent conflict. LDH cannot reduce waiver services, nor can they reduce funding for the applied behavior analysis rates. LDH is further limited by removing language in the bill that would allow LDH to move money around in order to address budget shortfalls in one area by pooling excess receipts from another area. This is a process that has long been used to cope with the challenges of operating a $14 billion budget. LDH is put in a position of having to potentially not pay the 13th payment, $146 million, to medical vendors, or make even more draconian cuts than will be outlined by Secretary Gee momentarily. The 13th payment, as you recall, is another legacy of the Jindal administration, which the governor and legislature reluctantly agreed to carry over into the 18 budget in the wake of the 17 budget shortfall. It's one thing not to make this payment when budget cuts are necessary and decisions are made as to what will and will not be funded. It's an entirely different proposition to intentionally exclude this funding from the budget at the beginning of the year. Nevertheless, the choices available to LDH under the committee amendments will force this choice to be made. All departments, not just LDH, must first eliminate funding for vacant positions. In essence, this means that whatever vacancies exist at the beginning of the fiscal year, a point in time that will be frozen, those vacancies can never be filled during the year. Despite the importance of the vacancy created for whatever reason, retirement, termination, promotion, no one could be hired, period. Imagine the consequences of that micromanagement if you're trying to run the Department of Health, you're trying to run the Department of Corrections, you're trying to run any agency of state government, and a vacancy is created and simply cannot be filled because the legislature has dictated that you can't fill that position. The Department of Corrections and the Department of Children and Family Services are arbitrarily reduced by $10.6 million and $19.5 million respectively. All of these reductions were made with absolutely no testimony from the departments or the public as to how these cuts would impact the delivery of services to the public. It's one of the reasons why we're here today, so you can hear what the impact is going to be on some of the departments that are hit most heavily. Instead, the amendments were made available late Sunday evening, discussed and voted upon with no testimony whatsoever, except that a representative of the Attorney General was called upon to speak at one point during the hearing. Now, there's several other committee amendments that are problematic that I want to just outline for you that don't directly impact the amount of dollars cut by a particular department. One of the few examples of specificity, the committee reduces the Department of Veterans Affairs by about $147,000. You'll hear what the consequences of that cut will be momentarily. Now, as I suggested to the committee, there is a significant difference between management and micromanagement. The legislature clearly has the prerogative to manage the budget by choosing to fund and choosing what not to fund. However, it does not have the prerogative to direct the executive branch of government in the administration of dollars appropriated by the legislature. The committee seeks to overstep that authority by requiring joint legislative committee on the budget approval of any change to the allocation of expenditures set forth in the budget. This potentially will grind the wheels of government to a halt at the time between each monthly meeting of the Joint Legislative Committee on the budget by not allowing the agency heads to manage the dollars that have already been appropriated by the legislature. In other words, money cannot be redirected unless and until approved by the JLCB at its monthly meeting. We estimate that there could be as many as hundreds of expenditure adjustments that would have to be considered by the JLCB if this amendment became a part of the budget process. One committee amendment seemingly violates the well-recognized Supreme Court decision of Henry v. Edwards by seeking to include a substantive change in the appropriations bill. You can't change substantive law in the bill. The amendment specifies that no funds may be used for performance adjustments or salary adjustments in accordance with a compensation plan that may be approved by the Civil Service Commission. This may violate the Commission's authority to regulate such employee matters and raises constitutional questions as well as separation of powers questions. Another amendment seeks to move money from the CDBG Homeowners Fund to provide funding for the Comey Diversion Canal, a greatly needed project in Louisiana, but this is a capital outlay expenditure, not an HB1 expenditure. And more importantly, if that amendment became law, it would potentially deprive 4,000 or so homeowners who've been ravaged by the recent floods from receiving the money that's been designated by Congress for that purpose. So I hope you can see from this cursory look at the budget the problems it creates. To give you an idea of the specific problems that will be faced by the various agencies, we've got some folks here who are going to give you some details, and we'll start with Secretary Gee.
Good afternoon, everyone. Remember that these cuts come on top of successive years, 8 years of the prior administration, of cuts to my department, which left us with half the number of employees and less funds than we had ever had historically to run operations. And on top of the $90 million of unfunded priorities that were very important priorities, such as fully funding managed care, making sure that we could pay home and community-based providers, and ensure that physicians were paid fair rates for services. These cuts are at the very least $750 million to our programs and would affect the health and safety of every Louisianian. Highlights among these are ending access to coverage of pharmaceuticals for adults. These would be all the adults in the Medicaid expansion population. Who could imagine doing a heart transplant or a kidney transplant and not providing any pharmaceuticals? It's something that we wouldn't even want to contemplate and is foolhardy from a medical perspective and a public health perspective. And would affect over 600,000 people in the Medicaid program. Elimination of over 120 inpatient psych beds, devastating access on the North Shore and Lake Charles and the greater New Orleans area. The cuts will likely force patients in acute crisis onto the streets and away from the care they desperately need, and into likely jails and other areas where we're trying to make a significant impact to decrease the overall burden for our state. We force noncompliance with federal orders, risking legal sanction to the state. This would force us into noncompliance and a DOJ concern regarding our nursing homes and our ELMS facility and the resources that we need to appropriately populate and staff those facilities and ensure that people are getting safe and adequate care. Dropping our Zika defenses. We are blessed that we did not have local Zika transmission last summer, but because of our climate and the likelihood of the fact that there will eventually be transmission, we would have to end all of our funding for the Zika response. It's estimated by the CDC that every baby, and it's a substantial number of babies who are infected with Zika, who get microcephaly will cost $10 million. This is just unfathomable and would affect the public health of everyone in this state. Ending local services, so we would have to cancel all of our programs, school-based health, clinical and access-oriented services, including behavioral and substance abuse health services. These would impact more than 135,000 residents through $70 million reduction to the DISH-LINCA contracts. And that would obviously end not just that funding, but the additional federal funding that comes with the state investment in those areas. The staffing eliminations that Commissioner Darden spoke about are of enormous consequence to our department. Imagine running a facility where you can't, if someone retires or takes a new job, you can't fill a position. Who's going to take care of patients if you don't have nurses? Who's going to make sure that the staff are safe at Pinecrest? In ELMS, we already have over 90 employees worth of overtime hours of the people that are working there, that we're working them to the bone. They're overstretched as it is. So imagine not being able to fill those important positions. It's irresponsible. And you know, there's a lot of talk about the cuts being fake or phony, and this notion that the budget can just take it, but I would challenge you to ask our medical schools and their faculty about these cuts that were real and after the second mid-year reduction. Last year we had the escape parachute and a cushion of Medicaid expansion. We were fortunate to have a very effective implementation and a high number of enrollees that allowed us to have managed care dollars and other federal funds that helped buffer the impact of a budget cut to my department. But these dollars are no more. We had the shift last year. We've enrolled the individuals, over 420,000. It's been a godsend for our state, but we don't have that escape parachute now. We've got to deal with reality. And so you don't like this reality. So as we have had an exercise in the past of going through these programs, and legislators say, well, why don't you look at your other programs? Well, I'll tell you what's on that list. And again, on our list, in addition to the cuts I described, are the elimination of the psychosocial rehab program. The legislature did not allow us to eliminate that, but the message they'll give the public is, oh, the department can just go eliminate programs, but when it comes to the hard choice of what program to eliminate, they refuse to make a decision and they refuse to take a stand. So unfortunately, though, we would have to eliminate pediatric day health, psychosocial rehab for youth, and virtually all behavioral health services in a state that is already compromised in its ability to take care of the mental health needs of its people. And if you don't like that list, it's the consequences of other options are worse, because at this number of $750 million, there just isn't funny money or fluff money or anything hiding in any corner of our department, because I assure you we have looked at that and we made cuts of over $50 million to our program offices and other areas of administration last year. So these are eliminating, the other options would be eliminating long-term personal care services, eliminating the PACE program. This is a program that allows elderly people to stay in their homes to get food and sustenance and care. Eliminating the ICFDD. These are facilities for the developmentally disabled that are lifesavers for families. Eliminating physical and occupational therapies. Eliminating case management. Elimination of the hospice program for individuals who are dying and need respite, solace, and comfort. Eliminating the ambulatory surgical center program so that people couldn't get colonoscopies, they couldn't get procedures in any setting other than an inpatient hospital. Eliminating hemodialysis and eliminating inpatient mental health services. So I assure you, these are all the choices available to us at these level of cuts, and they are all unacceptable, and they affect the 4.6 million people of our state in ways that we feel are irresponsible, and surely better solutions can be found.
We'll be happy to answer questions when everyone's completed their remarks. Next is Marquita Walters with DCFS.
Good afternoon. When When Dr. Gee talks about reductions of behavioral health, I want you to remember that many of the children that she serves are foster children in our system. And my main concern with this budget is the lack of understanding of the fragile families that are being affected by these cuts. We have over 8,000 children that pass through the foster care system each year. We serve over 900,000 families with food benefits that are 100% federal dollars that bring billions into our state through grocery stores and in places that sell food that would just be cut because we can't afford to run the program when we keep reducing the staff. We are already on an intervention with the feds with our food stamp program. We're already at the edge of not being able to sustain this program. One of the amendments takes away my authority to prioritize funding in the way we believe is the best thing for this state. We have said for 15 months since we walked into this store that the child welfare system was fragile and very nearly broken, and that we were going to shore it up and protect it from further cuts. And the governor and the commissioner have worked diligently with us through all these budget cycles to make sure that we didn't hurt child welfare. But this amendment will strip away 67 positions in child welfare. It doesn't even give me the authority to run the agency to follow the priorities that we have set as the most valuable and the ones most vulnerable. Because when you are the custodian and you are the parent of a child, which we are in this state, when a child enters foster care, you do everything you can for them. And when they need behavioral health services that aren't available, where are we to turn if those services are stripped for the most vulnerable children that we have taken through no fault of their own? These are children that have been abused and are victims. They are not children that are out committing crimes. And so the lack of understanding and compassion about our most vulnerable families is greatly disturbing to me. And it, as Rebecca also said, it doesn't take into effect the year upon year upon year of cuts. I walked into an office that was 2,000 people less than when I left in the Blanco years. 2,000 people less, half the budget with the same number of services and growing to be delivered each year. So these cuts are draconian, and they're not even sensical. The biggest chunk of money in our particular cuts, in the 19 million, which by the way is 70 million in federal when you add my federal match. So you can say it's a $19 million cut, but what I really deal with is $70 million in DCFS money that won't be there. And so when we look at that, the biggest chunk of it was in an investment to try to shore up our legacy systems in technology. We have systems that are 35 years old. How many of you are willing to work on a computer that is 35 years old? That's older than many of you. We have 5 legacy systems in the child welfare arena alone that workers have to come back in after a day out in the field and enter duplicate data into multiple systems because the systems don't talk to each other. So our attempt to try to do an integrated system and build a sequence-seedless system for child welfare, which is the federal name for what we need, is stripped away in this budget cut. I am concerned deeply that the cars that were cut, over 70% of our fleet has over 170,000 miles on it. These aren't cars that I'm driving around town to visit in. These are social workers driving to remove children from homes, to take them to therapy appointments, to take them to school, to take them to visit siblings that might be placed somewhere else, or to visit their birth parent. We're transporting fragile children. And when you break down on the side of the road with an infant in our heat in the summer, that's a pretty dramatic and traumatic experience that our workers should not have to endure. The lack of compassion in this budget is appalling. Thank you.
Thanks, Marquita. Jimmy LeBlanc, Department of Corrections.
Good afternoon, everybody. I too, like Rebecca and Marquita, that when we started with $180 million less and almost 2,000 positions less, and of course I've been secretary for 8 years. I've been through those cuts and have experienced those cuts, and to continue on that road is to me a public safety issue for not only our employees but the public. So let me kind of put things. The big picture for us is that currently, and we've been upfront about this. Our department is projecting current year $12 million deficit. Current year $12 million deficit, and of course we're working with the governor and commissioner to help out with that. And then initially, we had a 2% in the executive budget, which is about $9.7 million. And then of course the House Appropriation Committee added $10.6 million to that. So, when you pull all that together, that's $32.3 million that on July 1st that this department is faced with. And as we've said in committee, many times, we have one correctional officer with 170 inmates at Angola in the evening times. Our correctional officer to inmate ratio is well above what it should be in this country. And I just want to make emphasis of that. And on top of all this, mandatory adjustments, and that was talked a little bit about in the appropriations report that I saw. And with risk management, with retirement increase for a big agency like corrections, a retirement increase for our retirees is huge. It's like $4.5 million. But when you officer risk management, office of technology services, when you add all those into our budget, it's $9 million that's added to our budget. So it's kind of it's not a cut, but it kind of is a cut because those are big increases that it makes it look like. And over time, that's $160 million in our department over the last 9 years. So those adjustments makes it look like our department isn't participating in the budget cuts like the other agencies, bigger agencies in particular. So what does this latest mean for us? Where am I right now with budget cuts? And I know most of you are in touch with the task force, which I chairs with the Reinvestment Task Force, and we had a good morning this morning, I think, in GC. We got 220, Senate Bill 220, 221, and 139 out of committee this morning, which is a step in the right direction. But I say that because investment is the key to this. Investment is the key to our department. If we don't begin to invest in the criminal justice system, we're going in the wrong direction. And to continue to cut is going in the wrong direction. So where am I with this? I'll give you an example, and I've already shared this with a few of you. When we look at the cuts right now, I got to go to furlough inmates. And what I have to do is furlough inmates within their last 6 months, nonviolent, non-sex, that have to have a low-risk assessment, and furlough them. And roughly on July 1st, that number has to be 2,000 and then 250 a month for the next 11 months. And that's just something, and that amounts to about $8 million. So obviously it doesn't get us there. So what's next? Furloughs for our employees, for 1 day a week for all our non-security, non-medical, non-mental health. We would have to furlough our employees 1 day a week for a year. 1 day a pay period for a year. Vacancies. We have 235 vacancies in our department. 99% of those vacancies are turnover with correctional officers and probably medical staff. So what does that mean? So you take vacancies and money? Right now, when a correctional officer doesn't come to work in our department, we have to fill that post. We 24/7. We cannot not fill that post. So what does that mean? Overtime. So that's part of the projected deficit that we're faced with right now with these vacancies. We're trying to hire people every day. We're doing everything we can to promote, but at $23,000 a year, it's hard to do, and it's a very difficult situation. Let me back up a little bit here on employee furloughs. That's 350 employees. I want to make that clear. 350 employees, again, non-security, non-medical, non-mental health. When you talk about taking that money, if you figure the salary money in 235 vacancies is roughly $6.35 million. And if you take that, I'm going to have to spend $9.1 million in overtime. So you lose money. So I mean, when you start cutting vacancies for a department like corrections, you lose the money. So it doesn't make a lot of sense. And that's kind of where we are, guys. You know, like I said, I've been involved with the task force. These numbers are, you know, we're still working on it. These numbers don't add up to that 32 million, I can tell you that. I'm still working on like cutting day reporting centers, cutting out reentry centers at the local level, everything that we've built on and invested in at the local level that has our prison population down by 5,000 today. And if you take 5,000, multiply it times 2439, times 365, that's $44 million a year we're saving with those investments. Those investments are paying off, and we need to continue to invest, and that's what the task force is about. And obviously, we haven't portrayed that with the appropriation committee. And as the commissioner said, we haven't had an opportunity to talk about this with the committee, and I hope at some point we do have that opportunity to talk to somebody about it. So anyway, thank you very much.
Next is Joey Strickland, Department of Veterans Affairs.
Good afternoon, ladies and gentlemen. I've served as Secretary or Director of Veterans Affairs for our state in different administrations for over 14 years. And this is the leanest that I've ever seen my department operate in. We have just enough people to accomplish our mission of supporting our veterans and their families. Any further cuts would affect our ability to support our veterans and their families, and it would directly impact the quality of life they fought so hard to support. The bottom line, ladies and gentlemen, is that we cannot sustain any additional cuts in the Department of Veterans Affairs. Last year, we gave back to our state over $6 million to help close the budget gap. It was all of the reserve money that we had. There are no excess dollars left anywhere in our department. There is no fat. We're now cutting into the bone. If the additional cut of $147,638 becomes a reality, the department would have no choice but to have an actual layoff of five personnel and close 2 of our state veteran cemeteries completely. Burial of our veterans is critical, and if we could not accomplish that, it would give us a black eye on the national stage. That's how critical it is. Also, should the 2 cemeteries, one at Rayville, Louisiana, and the other at Leesville near Fort Polk, be closed, the state would be obligated to repay grant monies received from the federal VA for the construction of these facilities, which would be in excess of $10 million. This would make the budget crisis even worse and would deprive hundreds of veterans and their families the right to be buried in a state veteran cemetery near their family homes. And we only have 1 national cemetery in our state, which would not be able to meet the capacity that we need. 2 cemeteries have seen the highest number of burials of veterans and their immediate family members recently. The Veteran Cemetery in Keithville near Barksdale Air Force Base buried over 30 folks just recently. The Veteran Cemetery in Slidell buried over 59 veterans and family members also just recently. A veteran whose family could not afford the cost of burial was also laid to rest with the help of donations. Just in the last month, we have buried over 100 veterans and family members. Every day, even as we speak right now, we are burying our veterans and their families with dignity and honor. The loss of these services would affect 340,000 Louisiana veterans. This would not be a good thing for Louisiana. I'm going to be followed by the State Commander of the American Legion, Mr. Rudy Ford.
Good afternoon. My name is Rudy Borg Sr. I am the commander for the State of Louisiana's American Legion Group. We are approximately 20,000 strong at this point of the year. But when you stop and think about it, you say, oh, it's only 20,000. Well, we are 20,000 members. However, there are 9 to 10 other major veteran organizations. Altogether, we make up approximately 100,000 veterans that are involved in our communities, involved in our community service as well, helping veterans acquire their benefits, helping veterans to enjoy those last days of their lives due to various illnesses such as cancer, derived from Agent Orange and other illnesses such as that. Do we want them to go from around the central Louisiana area of Fort Polk, with all the military retirees we have there, who served 20 years plus in many cases, and they retired there because of the VA cemetery being put there, so their families would have a close proximity to their resting place so they could go visit them. I say that the Secretary told you that it's a detriment to the veterans. He is a veteran, and so am I. 21 and a half years, multiple combat tours, and I was fortunate. However, do we want those elderly veterans, their family members, to be buried in a civilian cemetery? I'm speaking on all 335, 340,000 veterans. No, we do not. And I ask that they reconsider the cut. It's not $146,000 when you hear the other departments, they speak about 10, 50, $100 million. It's the sacrifices made by those veterans for you and I so that we would be secure in our homes.